Namaskar. Welcome to Ahara Arogya Adhyatma, the light of samskara. Today we have a renowned orthopedic surgeon, very a popular person, Dr. Vinay Kumaraswamy. He did his MBBS from Bangalore Medical College, a very prestigious one where only meritorious students get the seat. And then he did his post graduation in Banaras Hindu University and he got trained in Manchester as well as Coimbatore for the sports surgery and other keyhole surgeries. And today he's going to talk to us about the frozen shoulder. Welcome, Dr. Vinay.
Thank you very much, madam. Thank you for having me here. Thank you for the opportunity.
Yeah. As a cardiologist, I have heard about the frozen shoulder, which we call as the Dressler syndrome in the patient who had a heart attack. Once they have heart attack and there is an injury, the body tries to heal it. And then, the antibodies go there. And because of antigen antibody reaction, the covering of the heart, which is called pericardium, and that gets affected and the phrenic nerve is also inflamed, and as a result the referred pain is there in the shoulder. So a referred pain in the shoulder can come during the heart attack, and heart attack patient may or angina patient may come to you, or when they have a heart attack also they may have a shoulder pain, they may come to you. But people should differentiate that the cardiac pain is the shoulder pain is different from the frozen shoulder. So please explain to our viewers what is this frozen shoulder, why it occurs, and what age group it occurs, and what is the management.
Yes, madam. Frozen shoulder is a very common condition. If I see 10 patients in my OPD, at least two of them will be frozen shoulder patients. The usual age group that it affects is around 40 years to 60 years of age.
Okay.
Frozen shoulder more commonly affects people who have diabetes, people who have hypertension, and people who have hypothyroidism. Many other conditions, like as you mentioned, after a heart attack or myocardial infarction, people can have frozen shoulder. Why it happens is uh, there is something called as myofibroblasts in the shoulder.
No.
Myo-
Okay. Okay.
Myofibroblasts are cells in the shoulder joint. They suddenly become active and start depositing fibrous tissue inside the shoulder. This fibrous tissue is a scar tissue. Scar basically means something when you get a cut, you get a scar. Exactly that. It is very tight. It is very inelastic. So when this fibrous tissue is deposited there, the shoulder becomes tight. The patient is not able to move the shoulders at all. They're not able to put their hand up. They're not able to put their hand behind. People have a lot of pain. They say labor is the most painful pain, and dental pain is the second most painful pain. And we've seen so many patients of frozen shoulder. We can say confidently that frozen shoulder pain is probably the third worst pain that any person can experience. It is that painful a condition. Patients cannot sleep in the night. Even if they somehow get some sleep, if they turn to the affected side, they wake up with pain, disturbed sleep. Even ladies can't unzip their clothes behind. They can't comb their hairs. They can't scrub their hairs. It is a extremely disabling condition.
Yeah. In fact, I fully agree with you. I have experienced all the three. I have two children. I had the labor pain. And then, I had the impacted the tooth, wisdom tooth. Till now, my wisdom has not come out. They are still impacted. And then the third one is I went to row. And then while rowing, I tore my shoulder capsule. And then I had the pain. So all the three pains I have tolerated, and then it is really restrictive. So what is the treatment then?
Most frozen shoulders are self-limiting condition. What it means is they settle down on their own. But a patient is not able to sleep. The patient is not able to wear their clothes also. We need to help them in that situation. We give medicines for that. There are some safe painkillers which patients can take for a long duration of time. That will help patients in frozen shoulder. Physiotherapy is a bedrock of treatment of frozen shoulder. What it means is extremely important. Our physiotherapy colleagues take the patient through a range of motion. The patients are stiff, so they gradually increase the range of motion slowly, day by day, adding 5 degrees, 10 degrees to their movements until they come back to normal range. So physiotherapy
Okay.
is an extremely important part of treatment of frozen shoulder. We have injections that we give patients of frozen shoulder. There are primarily two kinds of injection. One is called a steroid injection. The other one is called a PRP injection or a platelet-rich plasma injection.
Okay.
Depending on your surgeon's preference, the surgeon might decide to give either a steroid or a platelet-rich plasma injection. And all these injections help the physiotherapist and the medicines, and through this, the patient recovers.
Okay. Just because, by taking tablets, the pain comes down, the people should not get addicted to the medicine and start taking self-medication. Otherwise, they'll end up with the ulcer or a gastritis. So the alternative you have suggested. So what is the difference between the steroid injection and plasma-rich thing, platelet?
Platelet-rich plasma is your own blood that is drawn out. 30 ml of blood
Okay.
is drawn out, and platelets are
Okay.
separated. Platelets are
Okay.
believed to have healing factors, which will help in
Yes.
frozen shoulder. It
Yes.
depends on the experience. My personal preference is steroids. Instead of
Okay.
platelet-rich plasma, platelet-rich plasma is more expensive, and the results
Mm.
are not very predictable. Some patients improve,
Okay.
some patients don't improve. So
Okay.
steroids is my preferred injection that I give frozen shoulder patients. But these are
Okay.
special kind of steroids which does not affect the sugar levels of the patient. Once we
Mm.
inject them into the shoulder, they stay in the shoulder. They don't go out of the shoulder. So they
Okay.
affect the sugar levels at a very minimal sort of
Okay. Okay.
zone.
Okay. Now that's a very important point, because the diabetics who have the frozen shoulder, if the oral steroids are given, no, invariably the blood sugar level goes up. And since you are injecting in the joint and it is a localized and it is not absorbed in the blood, so the sugar levels will not go. And that's a very good point. And apart from that, drugs, do you require any surgery? What surgery is done and how is it done? Please let us know.
10% of patients with frozen shoulder do not improve at all. They visit multiple doctors, take a lot of medicine, change a lot of physiotherapists, take a lot of injections, and they don't improve. In those cases, who have
So
failed
those who
something
are
called as
doing the
conservative treatment.
window shopping, you stop the window shopping and give them the final
Yeah.
treatment. Okay.
So we do something called as an arthroscopic release. An
Mm.
arthroscopic surgery or a keyhole surgery is a very minimally invasive surgery where we
Okay.
make small holes in the skin, put a video camera into the joint called an arthroscope. The arthroscope will show us where the frozen shoulder joint is tight. We
Mm.
release that tight capsule and the patient will get immediate range of motion.
Okay.
Within a week's time, patients of
Mm.
frozen shoulder recover almost completely with an
Okay.
arthroscopic surgery. However,
Okay.
not all patients require arthroscopic surgery. Only patients who have not improved with medicines, physio, and injection. Those are the
Mm.
patients on whom we do a surgery.
Okay. So you mean to say that the first line is in the physiotherapy and then the medicine and then the injection. And if all that fail, then only the surgery.
True.
Is it that injury causes this? The sportsmen, do they come with this sort of frozen shoulder or it's only with the diabetics and the elderly people? The
Yeah, there are
youngsters
two
also
kinds
get?
of there are two kinds of frozen shoulder. One is called a primary frozen shoulder,
Mm,
where there is no specific cause why frozen
mm,
shoulder happens. Diabetes
mm.
is not the cause for frozen shoulder. Diabetics are more prone to develop frozen shoulder.
Okay,
So primary
okay.
frozen shoulder is when the frozen shoulder happens without any cause. That is about
Mm,
95% of cases.
mm,
5% cases are secondary frozen shoulder, which means that
mm,
there is a condition because of which patient has developed a frozen shoulder. It could be
mm,
an injury to the shoulder, which has
mm,
caused a tear in the muscle around the shoulder, or which has caused a fracture, because of which the
mm,
patient has gone into a frozen shoulder.
mm, mm.
Sometimes radiation treatment can cause frozen shoulder. Sometimes an
Yes,
infection
yes,
around the
yes.
shoulder can cause frozen shoulder. Those are called
Mm,
secondary frozen shoulder, where there is an identifiable cause. In those
mm.
cases, we treat frozen shoulder also, and we treat the cause which has led to frozen shoulder also.
Okay. One question, if there is a fracture or something in the bone, we can see in the X-ray. But this frozen shoulder, the X-ray may not be adequate. What other tests do you do?
Most important way of diagnosing frozen shoulder is clinical examination.
Okay,
Surgeon's
okay.
mind and surgeon's hand is the most important tool that a surgeon should use in diagnosing a
Good,
frozen shoulder.
good, good.
90%, we never prescribe an MRI for frozen
Mm,
shoulder unless we
mm.
are taking them in for an operation. So frozen shoulder is basically a clinical diagnosis. If the patient is not improving with with conventional treatment, if we are planning a surgery, then we get an MRI done. MRI is
Okay.
another tool which will help us in diagnosing frozen shoulder. And if we are suspecting some other condition along with frozen shoulder, then also we get an MRI. So
Okay.
frozen shoulder is primarily a clinical diagnosis. When we have
Okay.
other diagnoses in mind, only then we think of getting an MRI. So an MRI will
Okay.
tell us more definitively the
Whether
condition in
the
the frozen
capsule
shoulder.
is torn or what has happened, everything can
Correct.
be
Correct.
detailed
Two
exactly.
conditions are very common. One is
Mm.
frozen shoulder, other one is called rotator cuff tear. Rotator cuff tear
Ah,
also happens in people who are above 50, and
okay.
90% of rotator cuff tear, which is basically a muscle around the shoulder, are
Ah,
atraumatic. That means there is no injury and the cuff undergoes a tear. That's when you
okay.
should not do a self medication. Knee joint is a weight bearing joint where we put a lot of load on the knee joint. It undergoes arthritis with age. Shoulder
Mm.
joint is not a load bearing joint, it never takes any weight. So the age
Mm.
related change that happens here is a rotator cuff tear. Most muscle tears around the
And
shoulder are
to
atraumatic.
avoid this sort of thing, are there any exercises which you ask them to do so that the shoulder remains well? I do it regularly. No, that's the reason I'm asking. Should they do these exercises so that no the shoulder remains good and fit, and they don't get the frozen shoulder?
Absolutely, absolutely. Sure, exercises are extremely important, even for normal people who don't have frozen shoulder, so that they don't develop frozen shoulder. And people who have frozen shoulder, for them, exercises are even more important, so that
Hmm.
their stiffness is relieved. Shoulder
Okay.
has primarily three range of motion. One is called flexion extension, which is taking your
Okay.
shoulder forwards and backwards. Then there is a
Okay.
rotation. This is external rotation. This is internal rotation. Then there is
Okay.
abduction, where your shoulder moves on the side. So these are the
Okay.
three range of motion or three planes in which shoulder moves: rotation
Hmm.
and
Hmm.
forward and backwards and
Hmm.
sidewards. So they
Okay.
should do all these movements separately. And there is
Hmm.
something called a circumduction, what you were demonstrating, where you
Like this.
combine all the
Okay.
movements. This is
Okay.
a
Okay.
circumduction where there is a combination of backward movement, that is extension, there is
Okay.
sideward movement, abduction, and forward flexion. So they
Okay.
should do the movements individually and they should do circumduction also.
Okay, okay. So thank you very much, Dr. Vinay Kumar Swamy. So beautifully, so clearly, lucidly you have described, and I'm sure most of the people who are having pain in the shoulder and the frozen shoulder is there now, their worry is gone, and they will contact you for the getting the good relief. And thank you very much, because the treatment is there, and physiotherapy, if it doesn't work, last resort surgery is there. So people need not suffer with the pain and have the agony of the pain. So thank you very much for your kind interview.
Thank you.
Thank you.
Thank you very much
Namaskar.
for the opportunity. Thank you.
Okay.